Yeah, so in UK and US, paracetamol overdoses are the most common reasons for acute liver failure. But if you look at in India, the viral hepatitis, the Hep E, Hep A, and Hep B are the most common reasons. There are a lot of drugs which causes it, but I think for us, particularly in Indian population, the most important drugs that we need to think about is the isoniazid and rifampicin. Please, before we start any anti-tuberculosis drugs, please check the liver function test. It's mandatory, and we check them afterwards within a week. We check them regularly, at least for a month, regularly. Okay, so it's very important. We get, so these are all something which are preventable diseases, or that is those are like caused by not checking properly by us. It's important that we check for these liver enzymes before we start these patients on ATT. Okay, we had at least 4 patients that I remember over the last 6 months who had acute liver failures, almost at the verge of having a transplant because they were not checked. It was done from outside, but they didn't check the LFTs. By the time they came to us, they were in significant coagulopathy. A couple of them died of this, and then one of them made it to the transplant, the other one luckily survived without having a transplant. Now, paracetamol overdoses, as I said, it's most common in US and UK. What is the level that you actually say it's overdose in paracetamol? We normally get a prescription, right? 1 gram or 650 milligrams. So anything above 8 grams, if you take it within a day, anything over than that, that's classed as an overdose. Which, if you can imagine, it can be done quite easily. We prescribe 1 gram 4 times a day. Right, you just double the dose and you get overdose. So you have to be careful when you're giving paracetamol drugs also for painkillers. Most often, particularly in here, they just take it to just alleviate the pain. You don't want to come and see a doctor, and they just keep pop these pills, and then they get into liver failures. Okay. So before you prescribe any paracetamol, just make sure that you prescribe not more than 4 grams a day. I think it's double printed on it, but anyway, I just wanted to show the drugs, which I'm sure you'll be able to get on the internet. So, other causes apart from the paracetamol overdoses, hepatitis A related, it's very, very rare. Okay, so as I mentioned there, the 0.35%. So it's not common that acute hepatitis A causes acute liver failure. It's very rare. Cause liver enzyme abnormalities. You'll see ALT and ASTs in thousands, but not reaching a stage where you call them as having encephalopathy, jaundiced encephalopathy, and worsening. Okay, so most of the Hep A patients do recover without requiring any treatment. However, if they fit or take the criteria for a transplant, i.e. having jaundice, encephalopathy, and coagulopathy, and having metabolic acidosis, then you will have to go for a transplant for these patients. Okay, so don't ignore patients, but also at the same time, Hep A patients, but at the same time, you should carefully monitor these patients. We had a patient here last year who was almost at the verge of having a transplant. We were just, sitting on a very edgy fence because INR kept going up till 2.8. And then it started coming down. So we were worried that this patient needs a transplant. We actually got him worked up for kind of warned the patient, preempt them that they may need a transplant, but luckily that patient survived and didn't require a transplant. But something which you need to take it carefully, that we monitor these patients. Okay? Hep B related transplant, acute liver failures are also not common. Most of the Hep B infections, acute infections, are self-recovering. Okay, it's only about 15%, 20% they end up having into chronic active carriers and chronic active hepatitis. But most of the Hep A infections, acute Hep B infections, they recover by themselves. However, if they're not recovering, if the coagulopathy is getting worse, then you need to look at what are the reasons. Hepatitis D co-infection is also not so uncommon. It is common. Okay, so you need to look for somebody who's not responding to treatment. Then you have to look for any hepatitis D related. Okay, anybody who has actually got on immunosuppression, like particularly rituximab, you will have to start him on HPV prophylaxis before you start him on rituximab. Okay, so anybody who is going on chemotherapy, before you start chemotherapy with rituximab, you start them on Hep B prophylaxis, and you stop the Hep B treatment 6 months after you finish your immunosuppression. Otherwise, risk of reactivation is very high, and once you have reactivation, they end up having more incidence and more prevalence of having into acute liver failures. Okay, so Hep B, I'm sure most of you know that it's mainly relevant in pregnant patients because the prognosis and the mortality is very high in patients. But again, Hep B infections are not that common. Okay, the patients that we had, most of them are from the northeast territory that we are seeing from Assam, all these areas, and we had that in the pregnant patients, and out of two, one of them survived, one of them couldn't survive because, in fact, by the time she came to us, she was in a very, very bad state, and she couldn't even survive for less than not less than 24 hours. And Hep C causing acute liver failures are very, very rare. Okay, so there are other viruses which can cause it. I won't bore you with all those things. The other reasons, I'm sure you know about pregnancy-induced acute liver failures. So acute fatty liver pregnancy, HELLP syndromes, preeclampsia, eclampsia, related acute liver failures. Now, Wilson's disease, mushroom poisoning, autoimmune, Budd-Chiari, malignancies, they all can cause acute liver failures. But important things for you guys to remember is the viruses. Okay, as I said, in our country, the Hep B and Hep A, Hep B, and Hep E are the common viruses. So when you look for Hep B, you look for hepatitis B IgM core antibody. Okay, so that tells us whether there's an acute infection or not. By the way, I'm sure most of you know about HELLP syndrome and how to differentiate between acute fatty liver pregnancy, HELLP, and preeclampsia. Are you aware of it? Pregnancy-induced abnormal liver enzymes. Okay, so acute fatty liver pregnancy is where you have a lot of endotoxin-related damage, and you get necrosis to the endotoxins of your endothelial cells or the blood vessels, and that's how the necrosis happens, and that's how they develop into having liver failure. They behave like an acute liver failure, okay? And it's the pregnancy which induces all these things. That's what we call as acute fatty liver pregnancy. For all these things, the treatment is basically delivery of the baby, okay? And most often they are seen in the third trimester.